Hi, everyone. Today we're going to talk about atrial fibrillation and why your doctor should be concerned with this diagnosis.
Yeah, that is a fantastic topic, very long indeed, but we're going to cover the basics here. And I know this is close to your heart, Peter,
Very close.
as a cardiologist. So atrial fibrillation is basically an irregular heart rhythm. So as opposed to a regular beating of the heart, it becomes irregular. So you go from a sinus rhythm to an irregular heart rhythm. Do you want to speak a little bit more about that?
Sure. What I tell my patients, Neil, is that atrial fibrillation is one of the most common arrhythmias or irregular heartbeats that we see in patients. And in my clinic, maybe half my patients every day have this. So instead of one heartbeat coming down from the small chamber of the heart, there's lots of different heartbeats all firing at once. It's a very chaotic rhythm. So I always say that small chamber starts to fibrillate because everything's tugging at each other. Or sometimes I use the analogy, which not everyone likes, is it moves like a bag of worms.
That's a really good way of describing it, yes. And an irregular heart rhythm, I'm sure you've all heard the term atrial fibrillation. And we're going to have a whole other discussion about the risks, why doctors put people on certain medications, including blood thinners. But we want to give you an overview here. And the irregular heart rhythm, well, let's talk about statistically, what proportion of, say, over 60s have atrial fibrillation statistically?
Well, so that number is growing every year. And atrial fibrillation, as I said, is the most common irregular heartbeats. I would say about 10% of the population. I feel like that's more in my clinic. 50% of my patients every day I see it. But in general, about 10% of people.
That's a really great point because I feel like it's probably way more than 10% of the over 60, 65. I'd say my own estimate would be 20%. I don't know how they calculate these statistics. What would be the main concern if somebody has atrial fibrillation? Scientifically, what is the concern? What could go wrong with this irregular heart rhythm?
Sure. Atrial fibrillation, I always tell my patients, picture your heart like a house, all right? And you have three parts. You have the plumbing, the rooms and the doors, and the electrical wiring. The plumbing are the arteries around your heart. The rooms and the doors are the pumping chambers, the valves, which make blood flow in direction. And then the electrical rhythm of the heart, electrical wiring. And so AFib is an electrical issue, which can be caused by other things that we'll get into. But the problem with AFib and what we worry about the most is with atrial fibrillation is that your heart rate can go really fast because we talk about instead of one heartbeat coming down, you have lots of different heartbeats all firing at once. So some people may experience rapid heart rate. A lot of people have Apple Watches now. They detect it on that. So that rapid heart rate is sort of like you're running on a treadmill, even though you're walking. Your heart rate can be 130, 140, 150 beats a minute when you're just sitting down. Rapid heart rates over a long period of time, just like any muscle, weakens the muscle. So if you're running on a treadmill day and night for even 2 to 3 weeks, people can get a cardiomyopathy or a weakening of the heart muscle, which oftentimes is reversible, fortunately, if we get AFib under control. I think the thing that people are feared about the most is not necessarily that, is the risk of stroke.
Absolutely.
And it's all because of going back to the model of where your heart is fibrillating. That small chamber isn't moving, so blood flow becomes stagnant. When blood flow becomes stagnant, it can clot. A clot breaks off, the least path of resistance is out. Your heart, up your aorta, which is the artery coming off your heart, and the least path of resistance is the angle up to your brain. And unfortunately, people are going to have major strokes.
Yep. So that is the main risk that I'm aware of. It's so great, by the way, having a cardiologist here to explain all of that fantastically well. Thank you for that.
Oh, thanks.
And as an internal medicine doctor myself, that is the number one risk. And that's what we frequently talk to our patients about, is that everything is a trade-off with any decision you make. And again, we're going to make another podcast on this soon. But the issue is that if you have an irregularly beating heart, the risk of a clot forming is greatly increased, and that clot can go to the brain and cause a stroke. And this is borne out in statistics. And if somebody has atrial fibrillation, what other risk factors would increase the chances of a stroke happening?
Well, that's a great question. And really that pertains to the risk of developing AFib. And so we know that age is an independent risk factor. One of the most common arrhythmias. Having a history of high blood pressure is an independent risk factor for development of atrial fibrillation. dehydration, alcohol, caffeine, electrolyte abnormalities, sometimes associated with illnesses if someone's sick, increased cortisol or stress hormones in the body can all trigger atrial fibrillation. But the final common pathway for the development of atrial fibrillation is a risk of stroke. So lots of different people have atrial fibrillation. I have younger people, I have people of all ages, and what all cardiologists use and should be using is something called a CHADS VAS scoring system. And really simply what that is it's a risk scoring system looking at if you're above the age of 65, you get a point. If you're above the age of 75, you get another point. If you have a history of vascular disease, like plaque in your arteries, and it just goes really through your risk profile, and it really guides you on your risk of stroke. Because some people may not need to be on a blood thinner with atrial fibrillation because their risk of stroke is so low. And that's something that you really need to calculate with your doctor. And that's pretty straightforward to do.
Very great
It should
point.
be done, actually.
Yeah. And these calculators are all available online. And that's what any doctor should go, and any good doctor, because blood thinners come with risks as well. Let me ask you this, Peter. If somebody has atrial fibrillation, is there any hope of reversing it naturally? So supposing, as you mentioned, high blood pressure, which I'm sure is linked to insulin resistance, diabetes, if somebody tries to optimize their metabolic health, like lose weight, introduce some gradual exercise, eat better, is there evidence? I'm assuming there is some evidence out there that will increase your chances of reversing atrial fibrillation.
I think that's the main way of reversing atrial fibrillation, because your medications that you're put on only kind of help suppress it. It's not fixing, again, the core problem. And so we know that a big underdiagnosed risk factor and trigger factor AFib is sleep apnea. Sleep apnea just tends to be more common in obesity. So losing weight, eating healthier, less alcohol, moderation of alcohol is really the key. Those are all ways of really stopping episodes of atrial fibrillation. In the cardiology field, we have something called holiday heart, which is basically after a holiday weekend, people come up with atrial fibrillation. It's usually because they've done stuff in excess. So without a doubt, absolutely 100%. And actually, that's the main thing you should do, because medications never make you feel better.
Yeah, that's very true. Yeah, holiday heart syndrome. And this is, by the way, excessive alcohol consumption. There's many people who enjoy the odd drink and are fine. And I know that's a question you get as well. But we're talking about when people binge drink and then go into atrial fibrillation. That's a massive risk factor. I've seen that I've even seen it in young people in their 20s and 30s who go on some massive bender with alcohol. Well, I showed my Britishness there. Massive alcohol bender, and then they'll get atrial fibrillation. So well, we hope that was helpful. We wanted a brief discussion here. Look out for our future shows on medications which thin the blood, and also discussions with your doctor on how else you can naturally reverse atrial fibrillation. But we hope that you understood that. My final word here is that it's an irregular heart rhythm, and the main thing to watch out for is an increased risk of stroke. And please know that there are natural things that you can do. You have anything to add, Peter?
Absolutely. Being the healthiest you can be, it will always stop or help prevent heart conditions.
That's a great thing to say there. All right, everybody. Thank you for watching. Do check in the links down below. Make sure you've subscribed to our separate channel, and also check out our natural health and well-being store, ohiwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK, Europe. Keep going, everyone. Stay strong and keep doing your best to do everything naturally. We will speak again in the next show.